And the arterial pressure has to be high enough to overcome the capillary resistance to get the blood to flow through the capillaries and then back up into the veins. So if it wasn't, arterial pressure wasn't high enough, you would get edema, right? Because it's not going through very well. Arterial pressure rises during systole, and systole is the contraction. And diastole is when the heart relaxes. The only way I could ever remember those is it's dying, it's dead, so it must be relaxing. So that was the only way. I always got those two mixed up. Okay. The capillary blood flow is pressure, we just talked about, resistance, and the amount. So this would be the volume of the flow. That's what, sorry, that's what determines the blood flow. Vascular resistance is the friction between the walls, the viscosity of the blood, and the turbulence, how much it's turning, moving. Okay, I'm just trying to think. So this is just an example. It's 4 to 5 times the viscosity of water. So you've seen blood before and you know how thick it is. This comes to play with some diseases. It comes to play with dehydration when the blood is thicker. So it's more difficult for the body to pump it around. Okay. Turbulence is just movement, eddies and swirls. And they occur in the heart chamber, so once you can understand that once the blood is coming in, it kind of swirls around, and then as it's pushed into the ventricles, there's more movement. It occurs in the large vessels, the atria, ventricles, aorta, and the pulmonary trunk. So the reason they gave you this information was because of this, because atherosclerotic plaques cause turbulence in areas where they're not supposed to. And that could contribute to the formation of clots. And as soon as you get the formation of clots, of course, you're going to have problems with deep vein thrombosis, you're going to have problems with strokes, CVAs. So systole is when the heart is contracting, diastole is when it's resting. We had a chat about that already. Okay. We're talking about the arterial walls, and the arterial walls have that nice muscular layer, and they stretch and then contract again when the heart is relaxed. The venous return is assisted by the muscular compression of the peripheral veins. When they say that, they're talking about just moving around. When you're walking, you are pumping those veins, right? You're helping them to return the blood to the heart. So walking is actually really good for your circulatory system because it does help all that venous blood to come back to the heart. They talk about the respiratory pump. They're talking about you just taking a breath. So as you're breathing in and out, you're changing the pressure within the thoracic cavity, which is helping the blood return to the heart. The respiratory pump, I just explained it to you. Okay. Anyway, you can just read it through there. You can read that for a second and I'll change it. Okay. Get it. You might put through these two. So the three things that cause exchange are diffusion, filtration, and reabsorption. And it's obviously vital to homeostasis because without that, how would we keep going? You guys have done this already? We have. Okay. So we'll just kind of go through it quickly. Filtration and reabsorption. Hydrostatic pressure. Did that too? No, I think so. You think so? Okay. It's just that hydrostatic pressure forces the water out and osmotic forces the water in. So that's kind of simple. Simple way to put it. And I'll just leave it up for a minute for the people at home. I don't know where they are in their course. In a way, it's kind of nice that it's being repeated because it sticks in your brain a bit better. And I think we understand that about the capillaries already. Okay. Fluid recycling. That's where the lymphatic system comes into play. Now, the next chapter that we're going to do next week is the lymphatic system, so we'll probably see this again. So the water continually moves back and forth via the lymphatic system. So that's, we're kind of hooked into the circulatory system now. I'll just let you read through those. Yeah, let's do so well. Again, we're going to be reviewing this in our next chapter. I should move these ones into the next chapter. I have to rewrite them. Yeah, that would be good. Yeah, I could. I wonder if I could between them. Yeah, I could do that. I would make it easier. I'll look. I haven't read the power. See, I have a set of PowerPoints that Marty gave me. Yeah. And then I read through those and I change them all. Hope he doesn't know that. But they're on my stick, so they're not. It doesn't affect the original PowerPoints, yes, right? So yeah, they've been significantly changed. Oops. She doesn't ask me to stick back. I'll just buy her a new one and just give her a new one. Okay. Like here's your stick and I'm over yours. Yeah, right. Yeah, I got your new one. Yeah. Okay. That's great. Well, I'll keep it. Yeah. Well, depending what happens with these classes, the work's done, so it'd be kind of nice if I could keep them. Vasodilators. Vasodilators, you'll see actually a lot in your pharmacology. Okay? Things that dilate the vessels. I think of well, epinephrine for sure is a vasodilator. There's lots in little. So we talked about the baroreceptors already, responding to the blood pressure, and the chemoreceptors as well, respond to the change in chemical position and the pH of the blood and dissolved gases. Baroreceptors is just the location of where they are in the carotid and aortic sinuses and in the right atrium. So it just gives you a picture of where they are here in the carotids. And like I said, there's medications that affect the baroreceptors, and you'll hear them again in pharmacology. So you could easily see the baroreceptors being used in somebody with hypertension, right? High blood pressure. Here we're back to our brain again. I'll just let people at home see it. So thoughts become things. I don't think I've ever heard that before. Yeah, it was something that I worked in TCC, and our pharmacology instructor said that to one of the students because they were worrying about exams and they were worrying about everything. And she said, you know, if you keep worrying long enough, you're going to fail your exams because thoughts become things, right? Mm-hmm. So it's true. You can get yourself into an emotional state that affects your whole body, and you can start imagining that awful things are happening, and they might happen.
I would say what persists exists.
Yeah, that's true. That's cool. Endocrine, again, we know all about the endocrine system. Your epinephrine and norepinephrine hormones, and of course the flight and fight. So you're going to be, if it does affect your heart, it's going to increase your heart rate, dilate your vessels, do all those nice things, so you can run fast. So you'll use epinephrine if someone comes in cardiac arrest, actually, to get their heart started or to get it going, sedating, because it does exactly what you're looking for as far as a drug to stimulate the heart rate, to strengthen and to dilate the coronary arteries. And hopefully it will help you save that person's life. So the regulatory hormones, you're going to see, this is the ANP that you've already written that down, but these are the other three that affect the cardiovascular system. This one I know for sure, there's medications out for this, Angiotensin II. Yeah? You probably know better than I do. I haven't read that for a long time. So the antidiuretic hormone just triggers the kidneys to retain water. But the nice part is you can go back and look and kind of familiarize yourself with it. Angiotensin II, that's the one, right? Responds to a fall in the renal pressure. So if you wanted to increase someone's renal pressure, you would be administering that medication. This would be something you would be interested in if someone was hemorrhaging or bleeding, right? You want to increase or stimulate the red blood production. And that you guys have already written down. You've been good, you've already written it down. Oopsie, any jump. All this covers is the circulation to the brain, heart, and lungs, and of course the brain is going to get priority over everything else because it's the controller. Next, most important thing is the heart. Personally, I would think it would be the other way around. The heart should get attention first because it's the one that's providing the circulation to the brain. But apparently, the book doesn't read that way. The brain has the highest oxygen demand, and I believe that's probably why they've got it's the top of the priority list. Yeah, but without the heart, it's not going to get any extra blood anyway. So yeah, I agree. It's kind of which came first, the chicken or the egg? Yeah. Which more important? The brain? No, not really. So you have to keep your heart going. That's your next one on your list, of course. And your lungs. I'm just going to let you read through these. Not very many notes that you have to take. Oops, sorry. Just to make note that there's so many people out there doing the Ironman and all those really tough, exercise, very demanding exercise. It's really not that good for your body. It's very stressful, especially on your kidneys. Kidneys are very sensitive to high blood pressure and increasing the blood pressure rate. So intense exercise sometimes is damaging. And that's good because I didn't want to do that anyway. Yeah. So that was okay. I'll do this, but I won't do that. You're going to do that though.
Near the end of when you're week up in your show, you have to start. By the middle of the week, you're up to 12 liters of water a day.
Really?
Oh yeah.
Really?
My electrolytes were so off, it was ridiculous.
Wow, I can imagine.
And then you have to hydrate from Friday all the way till Sunday.
Really?
Yeah.
It's very odd. Now, what is the reason for that? Like, I don't.
The hydrating is supposed to make your muscles bigger.
Oh, so it appears like when you do the whatever poses?
Yeah.
Yeah, they disappear bigger. Really? Gee, I mean, I would have never think of something like that.
Yeah.
How did they figure this out?
It was brutal. Yeah, because it was like 8, 10, 12, and then, and then it started going down. It was 4, and then on Friday I can have half a liter up until noon.
Really?
That was it.
Wow. You gonna keep doing this? Good.
So crazy.
I was gonna say, it sounds like it's extremely hard on your body.
Yeah.
Your kidneys especially. I would be in kidney failure if I had done that to myself. It just wouldn't work for me. I already have compromised kidneys, so that could do that. Responses to hemorrhaging. The cardiovascular system, of course, tries to maintain the blood pressure and tries to restore blood volume. That's its main goal. And the carotid and aortic reflexes, which we talked or saw earlier, their response is to increase the cardiac output, so you'll have an increased heart rate, right? And vasoconstriction, so the person's arms and legs would be cold when you touch them. This is like shock. Okay. So the vasoconstriction continues. The venoconstriction helps more blood return to the center core. So if they're bleeding, they want to maintain your vital organs. So that's why the body would return the blood to the center core. The hormones, of course, that are going to increase your cardiac output, epinephrine, norepinephrine, those good ones again. It goes to a point where people can maintain, when they're bleeding, they can maintain their blood pressure, they can maintain their cardiac rate. Then suddenly, when the blood volume drops as they continue to bleed, everything crashes.
Like I you were talking about the young man?
Yes, the fellow, exactly. He was compensating. He was young and healthy, and he could compensate for the blood that he was losing.
Yeah.
But he probably wouldn't have gone another hour compensating. We had to, start IVs and give him extra volume, increase his volume, and blood products to increase the volume as well. So the younger and healthier you are, the better you are at sort of compensating for what's happened to you, right? He was very lucky, actually, that he was so fit. So this just talks about the long term, and they're restoring blood volume again. So it would be your body trying to produce more cells, more red cells, increase thirst so that you will take in more fluid to increase that volume. So 20% of your blood volume is lost before you go into shock. Shock, and it's called hypo, which is less volume, or hypovolemic shock, or blood loss. Interesting things that you wouldn't expect to see this. I had a young child who was up playing on the counter. I think she was about 4 years old, playing on the counter of the, looking in the cupboards and stuff. Yeah. And she fell, and she just fell back onto the floor. And she did okay for a while at home. Mom didn't think there was anything wrong. She didn't hit her head or anything. Then she became more and more pale and sweaty and stuff like that, so Mom brought her in. And what she'd done is she'd actually fallen down, and she clipped just right here underneath the rib cage. So what she did was she lacerated her spleen. She was actually hemorrhaging from her spleen, which was hard for anyone, like the mom wouldn't know this because it's invisible. You can't see it. But just the fact that she became more pale, she became sweaty. When she got to us, of course, her heart rate had increased. She was trying to compensate for that blood loss. But something as simple as that, just falling and just kind of nicking that spleen and causing it to rupture.
But they're so sensitive then at that age.
Yeah. And the thing is, with children, their abdomen is a lot bigger.
Yeah. And
a lot of the organs are sitting lower, not like adults where ours is kind of tucked up underneath, where we have our ribs to protect us. But she didn't. But that was it was interesting to see just that little fall, what it had done to her. Unfortunately, you can live without your spleen, so they just resect the spleen surgically. They just take it out completely. Okay, so onwards here. Strokes we've talked about, cerebral vascular accidents. Strokes are two types. They're either a hemorrhagic, where the blood vessel has burst and the patient is bleeding into the cerebral vascular system, or they're the clot kind, where it's been blocked off and the brain tissue is dying. And so there's only one that we can treat when they come into the emergency department. But we have to know whether it's a bleed or is it a clot, because you give them anti-clotting medication. So they actually have to go from Ashcroft, they have to go to Kamloops and have a CT scan. We cannot treat them in Ashcroft because we have to scan them first. Because if you ended up giving somebody antithrombolytics and they were having a bleed, you would just make it a whole bunch worse. So sadly enough, strokes are very difficult to treat because there's only a couple of hours that you can treat them. And once you pass that 2-hour time frame, the clot has done its damage and there's nothing much more you can do for those people.
Then is that the stage where their limbs start?
Yes, okay, yeah. So they'll come into you what they call hot stroke. They'll have the symptoms. They may have visual disturbance, paralysis on the side of their face, paralysis on one side. And if you can get them out of the emergency department and into Kamloops within an hour, they can get their CT scan, and then they can be treated with thrombolytics if it is a clot. And if it's not a clot, it might be a surgical intervention. So, but sadly enough, by the time we had a gentleman I worked 4 days last week, gentleman come in on Monday, and his family brought him in, and unfortunately, he had had the stroke the day before, and hadn't told his family. There was nothing we could do for this gentleman. It was too late for him. So, yeah, it was kind of sad, because we would have come in when he first had the symptoms. We would have been able to treat him and send him to Kamloops for treatment. Aneurysms. Aneurysms are an outpouching or ballooning of actually any vessel, but this one is the aortic aneurysm. And it's just that the walls become weakened. Some people, it's a natural weakening. It's a genetic fault, like they're born with aneurysms. They can be anywhere in the brain. They can be anywhere in the body. But the ones you hear most about are the aortic aneurysms that run right down here. Sometimes you'll feel pulsating. You can actually put your hand on the abdomen and you can feel that aneurysm pulsate. These are surgical interventions. They have to go in and they have to put they can either use another vessel or they can use man-made materials to just put a stint sort of in there to prevent that ballooning. These people come into you and they'll have unusual back pain or between the shoulder pain, and you can kind of wonder what's going on there. And they'll have low blood pressure and different things happening to their cardiac. Valve dysfunction, we talked about that just now, about the veins and the distortion of veins, ballooning of veins in the legs. Varicosities. Heart attacks we talked about. Pulmonary blood pressure. More of a sort of a balance, a homeostasis type thing, where the capillary pressure rises and pulmonary edema can occur. So what you're looking for is that balance, so you don't have that pressure rising or falling. Hypertension is just abnormally high blood pressure. This is kind of the standard now, is 140/90 for hypertension. Hypo can be in the 90s, usually 90/40, 90/50, that's like hypo. I mean, there's lots of people out there with 100/60 is normal for them, and they are the athletic group. They're usually pretty healthy. Their heart's not working that hard. That's why their blood pressure is so low. Age-related problems, decrease in hematocrit. That's just decrease in the concentration of blood. Clots, blood pooling in the legs. We talked about that, and that causes edema and swelling. So changes in the heart. It's just getting tired. That muscle, the heart muscle is getting tired after working so hard. So they just don't have the same output as they used to have. And changes in all of the areas that are related to aging. Atherosclerosis, of course, is increasing, especially if they're smokers, it will increase, or if they have a high fat diet and they have a high lipids in their system. Just mention the aneurysm because of the less elasticity of the vessels. Calcium deposits on the wall. Usually calcium deposits happen when the plaques are formed. They're already on the wall. And then the calcium comes along and starts depositing in that plaque. Then it makes a really hard vessel, and their blood pressure goes up because the vessels now are not elastic enough, and it'll make the heart work harder to get the blood through those vessels. Thrombi forming on the plaques, and then the thrombi release themselves, and you'll get a pulmonary embolus once it releases itself. There! Yay! We did good. We did good. Yeah. Okay. That's all. We even did it with a heart in there. Lucky you guys have actually done a lot of this before, because we didn't have to go through so closely. Okay, so we'll say bye-bye to Fahima. See you next time.
Bye.
Go outside, it's pretty cold.
I know, and it's so dark.
Okay, if anybody's sports mate, I watched the best movie last night. It's called The Impossible. It's based on a true story about this family vacationing in Indonesia when they had their tsunami.
Yeah.
Best movie ever.
Impossible?
The Impossible.